All right, so I'm going to sort of state some things I already sent you just for the records to make sure that you'll completely understand the question. Okay. Talking about Brady Allen, when he came into your jail in May 2021, the arresting officer told jail staff when he came in that he needed medical attention and that he had answered yes to the following questions when he came in: hearing voices, seeing visions, admitting to using meth and heroin within the past 72 hours, injured his head, had flu-like symptoms, appeared confused, disoriented. When the jail paramedic arrived to see him, he spent less than 3 minutes with him, never checked his blood pressure, temperature, heart rate. He's seen in his isolation cell for hours, pulling out his hair. How would you describe Brady Allen's medical care when he was at your jail?
Okay. Well, let me just back up just a little bit, answer your question the best I can. From my understanding, as the officer gave his initial assessment, asked those questions, a paramedic came and asked the same questions, his questions. And where he viewed his response, he didn't deem him to be in a critical state at that time. However, he did seem to be a little agitated, so he would put him into a place so he can calm down and talk to him. In regards to the hair, these guys are making constant rolling checks on that facility. And his hair was so fine pieces, they didn't notice it because he was standing up. If you see the view, you can see how he's standing up there. So they didn't notice it when they walked through and looking at that. So what brought the attention to Mr. Allen was when he started to remove things, apparatuses, fire apparatuses from the wall. And that's what got the attention about his behavior becoming a little more abnormal. So that's when they entered the cell. But to talk about his initial intake process, which is your additional question, the paramedic who saw him then made a decision of his questioning of him. He didn't deem it be necessary to take it to a different level at that point in time. They wanted to observe him first and see if anything changes.
It didn't appear as if he either had or looked at the piece of paper, the documentation where the arresting officer identified all these things he was observing as potentially this gentleman having a mental health crisis.
Right.
Are you satisfied with what the paramedic did and did not do at that time?
Well, at this time, first, let me make sure you understand, I'm not a trained healthcare professional. So we have to base that off of what their recommendation is at the time. So he made a recommendation off his preliminary reviewing of the document and his own assessment of the individual to do that. So based off that, I have to go off what that professional does and says is appropriate. Now, we've made changes, not off that, but just in general. And let me back up. I was in office 6 months when this occurred. So we were still off some old policies and procedures that I had not had a chance to look at. So since that time, not because it's incident, but since that time, we've made different changes how we're in process. Meaning now the deputies don't do that portion. It's all done by that paramedic off the stop. So that now that paramedic be the first one to talk to the deputies not doing these questions so they can really have that initial contact versus in that deputy. So they're doing that now. So we made some other things, changes in that facility and the intaking to make things better.
I just want to go back to that initial intake, that initial contact that the paramedic had.
Right.
I know that you're saying you're relying on them, but he never checked this man's vitals. And he never appeared to look or acknowledge that that document exists. Even in the internal affairs investigation, he said it would have been really good to know these things.
Right.
So did this paramedic, did the medical staff fail Mr. Brady when it comes to that initial contact?
I won't say he failed because, again, I don't know exactly what his complete conversation was and with Mr. Brady when he had the interaction with him. And I don't know exactly what he read off that sheet to give him to that summation what he came to. But I will say this, I think we are providing adequate service to anyone coming to this facility, then and now.
So even then, you believe that the medical care he received was adequate?
Right, as again I stated earlier, I am not a trained medical professional. I can only go off what the people we put in those places and pay to do that job tell us.
But you also have eyes and ears and you know what's in that internal affairs investigation and what medical staff did and did not do.
Yeah, and that's the reason I say we make changes after things occur that we didn't know that, in the beginning. So we made changes since that for our overall medical care, not just because we're grateful for overall changes we make. So every incident we have, we do an after action review on it, see what we did right, what we did wrong, and procedures or policies we can change, which we did on this case as well. And I felt there were some things we can change and do better after reading the report, just like you stated.
So after Brady Allen's death, you implemented changes?
Yes.
What were those changes?
We committed, well, let me back up. When I'm saying not only for Brady Allen's death, that was in my first 6 months. We were trying to make changes, but this really prompted us to make changes at a quicker rate because we didn't know what all we really need to do. Now, we made changes, and now, as I stated, one, that paramedic or physician there would be checking them first when they first come to intake now, not to be the deputy, they meet them. They've answered initial questions. Now we're making it mandatory that we check all vitals when they walk into the facility as well. That's if they are cooperative in getting us, letting us do that, of course.
That's if what?
If they are cooperative in letting us take the vitals, of course. We're doing that as well. And then we're also, now we're doing drug and alcohol screening now as well. That again, if they are cooperative in letting us do that too, to try to find out if they're on any, if they're at a high rate of alcohol or if they're on some type of narcotic or drug. So we're doing that too as well. And since then, we also implemented some devices that we're trying out now that should be implemented now in place. It's almost like it's a fitness tracker. So what it means, well, health tracker rather, will actually give us an indication what his heart rate is, blood oxygen level, and things of that nature. So we know if in any time that body starts to go into stress, we immediately notify as well. So we've been implementing a lot of things to make our health care much better.
So I want to make sure that I heard all of it because I don't think I wasn't writing notes. But the vital, that's now a mandatory thing when they come in if they're cooperative. So
Yes.
the blood pressure, the temperature, the heart rate, things that did not happen with Mr. Allen. And then you said that they wear devices to monitor.
Yes, we're fixing devices on our inmates that come in now that will monitor their blood pressure and oxygen level and their pulse rate and see if it's spiking any time. So we'll get immediate notification if their body going to any type of distress. So those are things we have implemented to try to improve our health care going forward through technology, of course, as well. So, and again, this is just not for Mr. Brady, just in general things we knew as me coming in office as a new sheriff. And again, this happened first 6 months, less than I've been in office. So we had an opportunity to implement a lot of things we wanted to try to change. So now I have opportunity to make those changes going forward.
Is the paramedic still working at this jail?
No.
Have you reached out to WellPath about Brady Allen's death, and if so, what was that discussion?
Well, since this is a still pending litigation, I can't speak so much my conversation with WellPath about Mr. Allen's case.
There are cameras everywhere, including inside the isolation room where Mr. Allen was. He is pulling his hair out, and you can see it in the video, piles of his hair. How did your guys miss that?
Right, so as I stated earlier, as they walking through, they're looking straight up, eye level to look at Mr. Brady. They're not looking so much on the ground to see what's there. They're looking at to check on him, making sure he's
Is there someone
running.
on the camera looking down?
Not so much looking at what's on the floor. They're really looking at him, his face up here to see what he's doing, his movement, to make sure he's still breathing, make sure he's still alive and still acting coherently inside the facility. That's when they notice that, hey, he's trying to rip off a fire suppression unit off the wall by seeing up eye level. We're not watching feet level, we're watching eye level up so we can see him, what he's doing.
One of your deputies was interviewed by an internal affairs investigator. Her name was Deputy Jennifer Williams, and she's expressed concern with medical staff not taking inmate care seriously. She said, quote, "I had went to the nurse and said, oh, this inmate is having chest pain. The nurse apparently replied, oh, he's going to just have to wait. And then the deputy said, I had a nurse shut the door on my face." What's your reaction when you hear that?
Well, I was appalled to hear it. However, after digging into it further, they weren't talking about this happened in the past prior to me getting here.
Right, this is a history.
Right, that's not history, so I can't really make a comment on what happened prior to me getting in office, but they're talking about a history before me getting here. But that shouldn't have happened then, and I can tell you it's not going to happen now. But I wasn't happy to hear that. But again, that happened prior to me getting here, so I really don't have a lot of comments on that, what they say happened prior to me coming in office.
Since you took office, there's been 8 jail deaths, is that correct?
7.
7. Well, I guess I have the wrong numbers. At least 5 of those are by suicide. Did I get that
3.
right? 3. I need to double check what I got
3
from the medical examiner office, because that's what I got.
Yeah, 3 suicide and 4 were what we like to call health or some type of drug type death. And what we don't end is this, and I'm pretty sure you know, we have no idea of who's coming to this facility. We don't know what their medical history is, their background, anything. And for example, we got a guy coming who was one of the ones in this number here, I won't give a name, but came in and was in stage 4 cancer. We had no idea. But when he gets in, we don't know the history, we don't know anything about these individuals who walk in. And sometimes they want the jail to act like a hospital. We are not a hospital. And sometimes people expect that the jail to give you better care than a hospital. That's not what we are. We are a correctional facility. And we get them to the hospital as quick as we can to get the proper care, but that's not what we do. This is not a hospital. So we have to, deal what we get. So we get people come in with stage 4 cancer, cirrhosis of the liver, all other type of health problems that we don't know about till they get in here, and drug problems that we didn't know. They get been out on drug binges and things of that nature. They don't tell us the truth. A lot of times we ask inmate, have you been doing drugs? No. They may tell the deputy no, but they come back and tell the nurse yes 8 to 10 hours later when they start feeling bad. Well, yeah, I didn't tell the truth. So those are things we deal with here in the facility as well that we have to how to try to cope with. So I think we're doing the best. I know we're doing the best we possibly can. We spend a lot of money in our medical care and mental health care here in Cobb. We have medical certifications through the state and throughout the nation that we have achieved. We're also in the process of now receiving our mental health care certification. We're one of the first in the southeastern part of the United States to have that. We're the only facility in the state of Georgia now currently that have a 24-hour mental health care. So now we're providing that mental health care when they walk in now and seeing trained physicians either on site or through telemed. So these are things that we're doing to continue to try to make this one of the best facilities in the state of Georgia.
You were just telling me that when you have inmates show up at your jail, you don't know what their medical situation is.
Yes, we don't know their history.
You don't know their history. Well, in Brady Allen's case, he came in and there was a document that listed all of these issues with him. That paramedic claims that he did not have it in his hand. Should he have had that in hand when he was talking and evaluating Mr. Allen?
Well, I'm not familiar with the document. I don't remember.
It's that one document where he answered yes to that long list of things.
Well, that's the form that the deputies fill out, our questionnaire. Right. So that's not a medical history.
It's not a medical history, but it's an observation.
It's just a question of what the deputies ask. And again, I kind of stated earlier, sometimes they don't tell us always the truth. He didn't tell us. Well, I can't mention. There was other issue with Ms. Brady that he did not bring to our attention, that, as you say, was in that form. Mm-hmm. That wasn't in that form that he didn't bring to attention that we found out later. So there's some other things that I can't mention about his history that we know that wasn't in that form, which would have made a better decision as well. But everything they write or tell you in that form all the time, man, is not always true until they come and get into a crisis and they want to tell you, hey, I did binge on heroin 10 days ago, I forgot. Well, I thought it was gone, but now they're starting to have these withdrawals and issues. I better tell somebody. So every time they tell you something that form doesn't always mean it's true. And that's why we try to get them evaluating and watch and see if we can make any determination from that as well.
I mean, he showed up not only with these arresting officers' list of things that he observed, but he also showed up with 7-8 bottles of pills, most of them antipsychotics. It seems as if there was documentation and things he showed up with that should have alerted medical staff that this person could be potentially having a mental health crisis. And I just want to make sure that I get on the record. Yeah. Are you satisfied with his medical care when he was detained at the jail?
What I'm satisfied what I can say on that portion is this. I'm satisfied that our deputies did everything they're supposed to do as deputies. My deputies are not mental health care professionals. I leave that up to the mental health care provider that we contract to provide that.
And that's what I'm asking. Are you satisfied with your mental health provider's actions involving Mr. Brady?
Based on what the mental health provider provided to us and his explanation, we're satisfied with that, with his explanation. Now, could things have been different? Possibly. Could it have been reviewed a little more in-depth and made a better decision? That possibly could have occurred. But based on his initial response, what we got, we were satisfied with his response. Now, did he or whoever the individual is, I won't say he, look at that carefully enough to make a better decision? I can always say anything or anybody, if I got more time to think about it, I might have done this a little differently if I'd have read this a little more in-depthly. But off the initial, I think he made a quick assessment.
I interviewed his parents, and his mother told me this after hearing and reading more about the internal affairs file. She said, quote, "They knew that this man had a problem, he was in pain, and it was obvious, and they ignored it." What's your reaction to that?
I would say I don't think, from my perspective, what we saw and what the healthcare provider provided us at the time, that he appeared to be in pain. He appeared to be that he was a little agitated about, we don't know what got him here other than being where he shouldn't have been. We was just assuming that was the agitation portion. And again, we didn't know his whole history. Now, when someone brings in pills, I don't know if it's his. Could he have stolen? We don't know all of the things.
It has his name on the bottle.
Right, but what's the inside the pill bottle? Sometimes you got a name on bottle, and what's the inside?
Could you have called the hospital? It's got the hospital and the pharmacy's name on it.
And they probably would have got a chance to do that.
But they didn't.
Right, but Andy, we can't do it on everyone they walk in immediately. They have to go through processes they have set forth already to observe and then follow up. So who said they weren't going to do it, just haven't got a chance to do it as of yet. And that's what I'm saying. So everything don't happen as immediate as you think it do. Not when I got 400 people come to the intake. So we got to make sure we spread out, let's get them taken care of, and then get followed up and find out his doctor, preferences and things of that nature. Nobody's saying we weren't going to do that. We just didn't have time to get it done in that time frame before these things occurred.
Knowing what you know about what happened to Mr. Allen,
yes.
Do you think at the minimum he should have had a medical evaluation and been sent to the infirmary?
Andy, can you make this,
Yeah.
you're asking the same version of the same question.
Yeah, well, I try to answer best I can. I think he was put into place for observation the best they could at that point in time. Again, I'm not the medical professional to tell you what his condition is because I didn't see him. I wasn't here, so I really can't answer in-depthly. But I would like to think that those guys we got down there do the right thing to put them where they're supposed to be.
Okay. Is there anything else specific what you can provide insight into Mr. Is there anything else that we're missing involving Mr. Allen?
Hold on,
No.
before you, sorry,
Yeah.
I'm just going to interject. There are a couple things that I think are missing in this conversation. This is someone who had gone on a heroin and meth binge for 4 days in a row.
Yep, and he says that.
Yeah, and had been in the hospital.
Yep.
So his state of mind. So the question is, this is someone who was trying to they were trying to calm him down. They were trying to get him in a place that they could actually give him
Some treatment.
medical care.
Right. So I guess I understand what she's saying, and of course you have it there. We know what his past on this paper says, and we know that he was on a bench for 4 or 5 days. Again, and it's like this. Hypothetical. If I'm on a bench and I come in, I may tell the officer or deputy anything I want to hear at that point in time because I'm okay. And then when I talk to healthcare professional, it may be a little different. It may not be the same thing. He or she is only acting on what he tells him at that point in time. And so if he tells the deputy one thing and then tells the healthcare professional something different, the healthcare professional, hopefully that's what we pay them for, is making an observation, not only what they say, but they're looking at their demeanor, looking at how they're looking, if they're sweating, looking at their hands, looking at everything, they're making an observation as well. And they mostly have real good experience in doing this, and we're hoping they make the right decision in making a call. So, and then we'll try to place him in a place where we can make sure, if he become agitated, to get him out of the environment, hopefully calm him down, and then see if what we can do of medical assistance we need to provide for him at that point in time.
He didn't really seem combative. I think he was yelling for help, but other than pulling that fire alarm,
well,
he wasn't.
let me say, I don't think he was yelling for help, Andy. He might have been yelling. So let's clarify that before you tell people he was yelling for help. He might have been yelling, but he wasn't like, help me. That wasn't the case. So let's make sure we clarify that.
The sheriff didn't say combative, he said agitated.
So let's just
and
make sure.
I'm saying, I'm just clarifying to make sure that I understand your definition of agitated. And the reason why I bring this up is because there's a conflict of whether the nurses felt comfortable enough to go inside or for them to bring him out. And that's one of the reasons why he never went to the infirmary, because some of your deputies made it seem as if he was fine other than yelling and pressing the button. And then there's the nurses apparently that maybe they didn't feel the same way.
I don't remember seeing that, what you're saying, that the nurses were scared to go in there anywhere. So I'm not familiar with that at all. But I am familiar with him pushing the button several times and yelling. Now, I just wanted to clarify that he wasn't like, oh, I'm hurt, I'm hurting me. He was just yelling, okay, not yelling for help. He was yelling. So I just want to clarify, because when you use that kind of tone where he was asking for help and he didn't get it, that is a real bad stigma for us, and that's not the case. He was yelling and pushing the button as if he wants to get out of the room.
Did you look at any of the video in that isolation room of him at all? How would you describe, when you look at that, do you think he's having a mental health crisis?
not being 100% trained in the medical thing, I can't answer that correctly. And of course, that is something I really can't answer because of the pending litigation.
I mean, I can't remember ever seeing someone pull out their hair and being okay mentally.
Yeah, but again, I didn't see him pull out his hair. We just saw the hair on the ground, so I didn't see that. So again, I can't really get too in depth with that portion of it as well.
What are we missing? What am I not talking about that you think is important?
I think for me, what's important is what we've done to try to improve mental health care since I've been in office. Again, this happened within the first 6 months or 5 months I've been in office. And we made tremendous changes and strides going forward since that. With all the new technology we induced into this facility, we've been accredited by several healthcare facilities now, how we do business, our practices and procedures. We've changed a lot of stuff going forth to make us, I think, one of the better sheriff's office correction facilities in the state. So we are always changing after every incident. We've always been truthful, we've been transparent and willing to talk to anybody about what we've done. So we don't hide my actions here. I think for the most part what we do, we want our community and everyone to know that we're across the board with it. As I'm talking to you, you know, in the past and other places, people won't talk to about these
No,
things.
and you know what?
And
I give you credit because you're
I have
one of
no
the
issue
few
with it.
people that will actually sit down and talk about this,
Yeah.
even if it involves potential litigation. So
Yeah.
I give you a lot of credit for that.
And I
appreciate
have
it.
no issue with that because I want you and everybody to understand that I want everybody to know that we're trying to do the best thing we can, and we're not a hospital. We get people come in here that have health problems, like I said, stage 4 cancer, liver issues, you name it, they got it. Hepatitis, stage 4, all type of ungodly disease. We have no idea. And then once we find out, we got people who may have cancer, don't give us his right name. If we know the right name, we can look at medical history and figure out what's going on with them. So we have those things to deal with as well. But sometimes I think, and this maybe not a great thing to say, but people think the jail is a hospital and you're gonna get the same level of care you do when you get doctors. And we don't have doctors here to give that same instantaneous care that you do at a hospital when you walk in there. So I think we're doing some great things here at Cobb County Sheriff's Office to improve our health care with technology, a new medical staff that came in, the changes we've made, some policies that we've seen, and by being open and transparent to the public, not running from interviews, just trying to be as open as we possibly can, what we can talk about. So I think we're doing some good things here. Like I said, we're the only one in the state right now providing mental health care. Why? Because I saw it was a need, i.e., let's say it was a need.
Mr. Allen's case?
All our mental health cases. We figured that over 80% of my people got mental health care problems. Not Mr. Allen, over 80% of people in my jail got mental health problems. So how do you fix it? Let's try to get some people who's trained to do that. So that's the reason why Cobb County is spending the extra money to bring trained professionals in and try to deal with these individuals. We're the only one in the state doing it at a lot of money. And that's how much we care about trying to take care of these individuals once they come here. So I do truly believe, and I do know you know this, as they cross this guard line, they're under my custody, care, and control. It's my responsibility to take care of them. And we're trying to do that by improving health care, mental health care, and everything in this facility to make it better for them when they're here. Right now, we also partner with the state. The state is bringing in a behavioral health, mental health care unit in our facility. Because we're the only one in the state that has a 24-hour health care. They want to partner with us because we're doing some great things in that avenue of mental health care, of trying to provide that level of support to these inmates in this facility. So that tells you, in my mind, that Cobb is trying to do the right thing. We're spending money. We're bringing in other healthcare professionals. The state's partnering with us on this program as well. So I think that hopefully it shows that we are trying to do the right thing to get everybody safe when they come inside this facility.
Sure, thank you very much. I appreciate your time.